If you are a psychiatry resident practicing in India, Japan or Korea, you have likely seen Blonanserin on the charts, but if you are looking for it in standard US textbooks, you probably came up empty-handed. This is your high-yield pocket guide to the antipsychotic that is often called the metabolic-friendly choice. Let's break down exactly what you need to know for your rounds. Blonanserin is a second-generation atypical antipsychotic used primarily for schizophrenia. It has a novel structure that sets it apart from the other meds you are used to prescribing. Think of its mechanism like a sniper rather than a shotgun. It is a potent antagonist at dopamine D2 and serotonin 5-HT2 receptors. In fact, its affinity for D2 is higher than most other atypicals and actually closer to haloperidol. But here is the key clinical advantage. It has a very clean receptor profile. It has negligible affinity for histamine H1 muscarinic M1 and adrenergic alpha-1 receptors. Translation: you get significantly less sedation, less weight gain, less hypotension, and fewer anticholinergic effects compared to drugs like olanzapine or quetiapine. Now for the practical prescribing numbers. The tablets usually come into 4 and 8 milligrams. You will typically start a patient at 4 milligrams per day given as 2 milligrams twice a day. Your target therapeutic range is between 8 to 16 milligrams daily with a hard maximum of 24 milligrams. Here is the single most important clinical pearl you need to remember. You must tell your patient to take Blonanserin with meals. This is non-negotiable. The bioavailability is extremely low in a fasting state, so taking it with food is required to get the drug into their system effectively. When it comes to side effects, remember the trade-off. Because it has such potent D2 blockade, the risk for EPAs, specifically akathisia, tremor and rigidity, is higher than other atypicals. It is generally safer than haloperidol but riskier than quetiapine. You need to monitor closely for movement disorders and be ready to use prophylactic anticholinergics or beta blockers if akathisia emerges. However, the massive upside is the metabolic profile. It is weight neutral with minimal effects on lipids and glucose, making it an excellent option for patients with metabolic syndrome, diabetes or obesity. So to summarize, Blonanserin is your go-to distinct atypical when you need to avoid metabolic side effects and sedation, provided you can manage the higher risk of EPAs and ensure the patient eats when they take it. If you found this quick breakdown helpful, make sure to subscribe for more high-yield psychiatry reviews and let me know in the comments which drug you want covered next.